I had Devin in Duluth. It was not a warm, fuzzy, loving experience. It was come in, have your baby, we're going to transfer your rooms, and then we're going to get you out the door as quick as possible. With my second baby, I was employed here at OMC. I delivered elsewhere, and my doctor was fabulous, but my nurses were terrible. So when it came time for the third baby, I'm like, I'm going to get this right. I'm going to go to OMC because I know exactly what to expect. They're going to be open and honest in their communication. And then my stay got complicated. He was born kind of rapidly, and when that happens, they have some fluid in their lungs when they're born, and it has a hard time exiting the lungs.
James came out, and he did have a little bit of trouble breathing shortly after birth.
That can be really scary to watch your newborn kind of be dusky, not completely stable. And, things kind of turned around and things were going really, really well, and was like, okay. And then he developed the low oxygen saturations. He developed the nasal flaring, those signs of respiratory distress.
There's kind of some more serious things that we're looking for and we want to rule out, because those things, we probably would have to send down to Children's for further evaluation.
And my first thought when I thought of having to go down to Children's was, no, I don't want to. I want to stay where I know that, the care I'm receiving is great.
Sometimes as healthcare providers, we can get caught up in thinking just this is the care they need and this is the route they have to go. But if you put yourself in that family's position, this is a really big deal. You're asking them to pack up mom, pack up everything, pack up the baby, go to a place they're not familiar with. So I just feel like emotionally and physically, that's just a lot to ask of families.
It was great because they were able to rule some of those scarier things out that would be like an immediate, transfer. So that was really, really comforting. They watched him for 2 days, and then I was able to discharge home with him. It still gives me the goosebumps thinking I got to stay here. I got everything that I wanted for my baby and myself.
I think the word has gotten out that we provide awesome OB care here, and our numbers are showing it.
The quality of care, the doctors are amazing, the nursing staff is amazing. It's just all around a great experience.
This is our passion. We love delivering babies. We love taking care of families.
As a mom myself, when I take care of a patient, I want them to have the care that I had with James. It was amazing.
So I think with our growing community, we're having a growing number of babies being born. They're coming to our facility.
And because our funds are limited, we're looking at how we can stretch that $1 into making the biggest bang for our buck. What could we benefit the most from? What could our patients benefit the most from with X amount of dollars?
I know we've been interested in getting some birthing stools and a birth swing. These are all things that just kind of help laboring moms move into positions that make labor go a little bit quicker and a little bit more comfortably.
There's a lot of other things out there that would be really beneficial as well, just because they really are kind of at the forefront in research and what you need to do to have a successful labor.
Babies are the future. These kids are going to grow up and be community members, and it's really important to keep families here and provide good care for them and to kind of see that future grow. So I think you're investing in the future.